According to the Universal Declaration of Human Rights, everyone has the right to a standard of living adequate for the health and well-being of themselves and their family. This raises the question, why do so many people live on the streets sleeping tough? Homelessness is a complex issue that affects people living in cities across the world. In this episode, we'll be speaking with some change makers who will share how 10 global cities are taking on homelessness and the innovations that are proven to work.
This is the Public Health Insight Podcast.
My name is Gordon, and I'll be your host for this episode, along with my fellow co-host LaShawn and two special guests.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
Tamaru Mamo joined Bloomberg Associates in March 2014. Drawing on more than a decade of experience working for the New York City government, Tamaru is committed to helping cities tackle the many social and economic factors that affect the health of their most vulnerable residents. Currently, Tamaru helps clients address a broad array of issues such as street homelessness, disparities among boys and young men of color, and tobacco control.
Linda Gibbs is a principal at Bloomberg Associates and served as the Deputy Mayor for Health and Human Services for New York City from 2005 to 2013. Supervising the city's human service, public health, and social justice agencies, she spearheaded major initiatives on poverty alleviation, juvenile justice reform, and obesity reduction. Two of the collaborative efforts she has shaped to address significant social challenges are Age-Friendly NYC, a blueprint for enhancing the livability of older New Yorkers, and Young Men's Initiative, an initiative addressing race-based disparities facing Black and Latino young men in the areas of health, education, employment training, and the justice system. She also improved the use of data and technology in human service management, contract effectiveness, and evidence-based program development. During her tenure, New York City has been the only top 20 city in the U.S. whose poverty rate did not increase while the national average rose by 28%. Tamaru, Linda, welcome to the Public Health Insight Podcast.
Great to be here.
Thank you. Nice to see you both today.
Thank you. So to start off, you both currently work for Bloomberg Associates. Can you share a bit about your ongoing work in the organization and in each of your specific roles?
Sure. Bloomberg Associates is this really cool operation. When Mike Bloomberg left City Hall, he wanted to gather all of the expertise of the managers who worked in various facets of his city government and put them together in a consulting group and then provide pro bono consulting advice to mayors around the world. He realized while he was mayor of how critically important that frontline task is. Nobody is as close to the issues or the power to actually address the issues in an immediate way than mayors are. And so he really wanted to create a group that would be able to support mayors in achieving their greatest ambitions. And so we get to support mayors, not only in cities here in the United States, but also internationally. And so each of our disciplines at Bloomberg Associates is focused on our own individual area of expertise. As you heard from the introductions, Tamaru and I have worked long and hard on public health and social justice issues. And so when mayors are keen to address those issues within their jurisdictions, we get deployed out to help them. And it's a real privilege. It's a wonderful, wonderful opportunity.
And I would say during our work with Bloomberg Associates, homelessness is an area for which cities have requested support most often in our practice. And the co-authors, all the co-authors knew each other from our time in New York City government. Jay at Bainbridge and Muzzy Rosenblatt. They've also collaborated with us at BA with our ongoing work to address homelessness with several cities. And that's related to how this book came about.
Awesome. So, how did you each, ultimately decide to commit your career to public service? Did you stumble on this, by accident? Was it something you've always been interested in, or did you have like an aha moment where you realized that was the path for you?
For me, so I'll go. I guess we'll create the order here. I'll go first. Maybe Tom or I'll try to switch off with you. But here I go. So for me, it's interesting. When I went to college, I had been applied and admitted as an art student. And so, I got to the studio and I loved it. I still, have it as a hobby. Um, but I just found myself as I was taking other courses undergraduate to really be gravitating to the government and public interest related activities. And so by the time I graduated from college, I shifted over to political science and went on to law school to focus on state and local government law. Now, it's really interesting. I say that because, on the one hand, it's been something I, focused on in my education many, many years ago. But the thing that I think has kept me in government is the really kind of the awesome responsibility of taking the authority and what power does exist at the municipal level where I have focused, and realizing that you can do so much to improve people's lives, but it's really hard. And if you come at it from the perspective of really understanding that that systems are constantly like shifting and altering, and that they can become worse and they can become better, but ultimately it takes a real reform-minded spirit in order to keep pushing toward that positive trajectory of improvement in the public interest. And it just really, really excites me to see how the power of government can be made to improve people's lives. And so any opportunity that I've had, I'm sort of like a reformer from within. Is any opportunity has been, to me, it's a great way to really dedicate your life to helping to make a better world for everybody. And so I'm a little bit of a government junkie in that regard, but have always been so impressed with the people that we meet in cities that are devoted to this work and to achieving, their dreams.
I didn't know I wanted to work for the city until I left graduate school, and frankly, I was looking for different jobs, and I knew someone in the New York City mayor's office, and I started out in government, and it became clear to me that I had a chance to be a practitioner, and I'd previously thought about becoming an academic, and this was much more appealing. And then from a public health perspective, I thought, this is the best way to make a population level change, especially in a city. In a large city, you could change policies and practices and really have an impact. And I watched and participated, in several of those initiatives with people like Tom Frieden and Linda and Mayor Bloomberg leading the way. So it was really an incredible experience, and it just became apparent to me that I guess I'm an urbanist. I like working in cities, and I get to do it as my job, and I'm passionate about it.
Yeah, fantastic to hear. So like you mentioned, Tamru, you and Linda and a couple of other co-authors co-wrote a book, titled How 10 Global Cities Take on Homelessness. Can you kind of get into some detail about how the idea of this book came along?
So like I said, Bloomberg Associates works with cities in the U.S. and across the globe, and the topic of homelessness comes up a lot. So let me name the 10 global cities in our book: Athens, Baltimore, Bogota, Edmonton, Houston, Los Angeles, Mexico City, Nashville, New York City, and Paris. So they just happen to be cities that in one way or another we ended up working with. And we convened this group of city leaders working on homelessness in the summer of 2018. And we were all struck by the similarities and approaches to the problem, despite the individual, the unique differences between the governments, the countries, the cultures, the social norms. But then we found so many commonalities between the cities as well, that when we started delving into this work, and Linda did this thing where we, at the end of this convening, she just summarized all the commonalities. And the thing is, people said, you should write a book about our experiences. And so this is a book about our partner cities. This is a book about them. And that's how this book came about.
That was the story, and it's really interesting because, as Tamaru said, each city has like incredible uniqueness and difference from each other in language and culture and religion and the population composition and governmental bodies. And so it was really striking how much the cities were going through the exact same challenge. It's as if you, as it related to dealing with tackling the issue of rough sleeping and overcoming street homelessness for folks who found their way there in each of their cities. And so the commonalities were just so what is it? There's issues of course, affordability of housing and access to housing, but that's not true everywhere. And even in places where there is enough affordable housing to meet the need, there's still people on the streets. And the issues around the underlying system failures that really do let down the most vulnerable people, people suffering from mental illness and substance addictions, people who are the victims of family violence, young people who are pushed out of their homes for lack of parents' understanding of their sexuality and their gender identification. And then just issues of people who are, sort of just down on their luck for so long that it tests the ability of family and friends to continue to support them, and they sort of get pushed out. Like, that's just a universal story that cuts across every single society. And what was really exciting to this group of people, and it's interesting because they work really, really hard, and they are just, you've got to be the most dedicated public servant to be willing to both take the heat that the public puts on you for how come you haven't solved street homelessness, right? And so people who will continue to work in the public roles with that kind of pressure do it because they have a real care and compassion and they want to solve this problem. And it was just so compelling when we brought them all together. And part of the reason we brought them together really was to acknowledge them and acknowledge the hard work and give them a little bit of a respite and give them a chance to talk to each other and learn from each other. And that's what really came out of this convening, was this sense of connection, strong connection they had to each other, and the belief that a continuing dialogue would allow them both to learn from each other and pull the best of what each of them was doing, but also just provide some peer support. Somebody else who knows exactly what it is they're going through and being able to just listen and help them to process what they are trying to tackle and solve.
Awesome. Thanks for sharing that insight. And homelessness, that's what the book is focused on. Homelessness is a commonly used term, but there doesn't seem to be a common, agreed upon term globally for what homelessness actually means. So could you share a little bit about from how you define homelessness and, how big of a problem is homelessness globally?
I don't mind taking that one. So I think that it's important to acknowledge as I hate the idea of one definition, and because we have our own definition here, and I could talk about that, but I actually want to share what everyone else does. In the U.S., the homeless, you're homeless if you live in a shelter or you sleep in a public space not meant for habitation. And Canada has something similar. But then if you look at places like Mexico City, where you have informal settlements in the surrounding hills of the city with no electricity or sewage, and these are areas that might be considered uninhabitable environments in the United States or Canada, but in Mexico City, this is tolerated as a form of startup housing, and they would not be counted as homeless. In fact, the government may come in at a later point and formalize the settlements and add sewage and electricity. And so even in places like Bogota, where you have these recyclers, the recicladores, they're called, who they go out and they collect recyclables in these wooden carts with tarps, and they sleep inside the carts. And we asked the city officials in Bogota how we define them. And then we agreed that we would just ask them about their housing status. And some of them said, I guess I'm homeless. And others said, I'm not homeless. I have a place right here. And so it really depends. And then, in other places across Europe, homelessness is a matter of social exclusion as well. And that's a big factor. And then one more thing. So in Athens, for example, there are many immigrants sleeping on the street, but only Greek nationals are considered officially homeless. So there's lots of different types of definitions. And I don't want to say that there's a favorite definition or a best definition, just that it's different. And it really depends on the values, the government, the capacity to address this challenge, and even how countries and cities incorporate human rights beliefs as well.
Another kind of a vagary in the definition is also frequently referred to as the concept of housing insecure. And so under the Department of Education in the US, a child in school is considered homeless if they're living doubled up in somebody else's house and are not a member of an immediate family that holds the lease. And so the how you define it does have some political weight, because you're trying to make a statement about whether people have achieved that vision of the kind of what does the basic human right of being able to live and have a house and have an adequate food and access to basic, human dignity. Does that include somebody who is, couch surfing from one family's house to another because they can't afford their own house, right? And so there's, the definitions shift also for what you're trying to get at and what you're trying to describe around the greater society that people are living in.
And I feel like I skipped over one part of the question as well. I apologize. And you asked a very good question about what's the magnitude on a global scale of the problem. And the truth is, it's hard to say, because not all countries, not all places require counting, or when they count, don't use necessarily the same methods. But we know, for example, in the United States, we have around more than 500,000 people on one single night, if you go out and do a count, living in shelter on the streets. And in Canada, I think it's around between 25 and 35,000 on a night. But you look, if you look beyond one night and you actually look at how many, because people move in and out of housing over that year, there might be a couple 100,000 who experience homelessness in Canada over a year. So there's a temporal aspect, and then there's there's the point in time, and then there's the fact that not all places count, so we don't know that true number. So I could say something like, well, certainly hundreds of thousands, possibly millions, but we know one thing, is that every city we've gone to, it's been a problem, it's been a challenge, and I don't think anyone's adequately addressed it.
Yeah, and I know some numbers that I came across were from the UN, and estimates up to 150 million people are homeless globally, which is such a it's such a crazy number. Like it's huge. And the fact that you mentioned, we're just not certain because, some cities may report it, some cities may collect data on it. There's just so much uncertainty behind it. But without a doubt, this is for sure a public health issue. And in public health, we always love thinking about some of the root causes of what drives homelessness. And I know that you mentioned earlier, there might be a background with mental health illnesses, addictions, domestic violence. But what are some of these root causes that you both identified when you were going through this book? And in other words, how did we get to where we are now?
So I think it's a combination of system failures, either inadequate or non-existent systems, like in the absence of addiction treatment services, or the failure of things like addiction treatment services or mental health services, or public safety interventions to deal with domestic violence. And when those systems fail, if you think about it, they're serving people who are very vulnerable. And oftentimes they've been, in a need for services for a long time. And systems can either not function super effectively or super efficiently, despite best efforts. And sometimes they're just rationing services. And like if you're the pain in the butt client who just like refuses to cooperate, and you got 10 people standing outside the door who are begging to get in and will cooperate, you got to make choices about who's the best person at that point in time to receive services. So there's a lot of push out of service systems. And so those kind of, the tough, ornery, or just less capable individuals to manage themselves through bureaucracies fall out of the bottom of these various systems. And then what you have is you have family and friends that are also kind of just burnt out, right? It's like, how many, I've had colleagues, friends, people I know, and they're like, I'm sorry, my son, I just can't take him anymore. He's ruining our entire house. He's ruining our life. I cannot let him back. What can you do to help me get him into a shelter, get him into supportive housing? And so like families, entire families can be really shattered by the presence of a really, really tough individual, and they love them, but they just can't sacrifice the rest of the family. And so in many ways, what you see in the people who do become homeless are, they're falling out of these either inadequate or, not enough services or poorly run services. And they're finding themselves on the street. And then the other, then you get to the point, okay, so if it's really the failure of multiple systems, but the solution also requires those very systems to address the problem that needs to be addressed in order to overcome the homelessness, you can't do it unless you get the people who are providing those services to the table, talking to each other, and agreeing to address the very failures that generated the homelessness in the first place, which means they've got to say, I understand that it's my problem to solve, that I am a contributor to this problem, and that I am fundamental to the solution. And they've got to commit to like working together with other people and other systems and kind of smoothing out all of those knotty bureaucratic rules that make system mismatches in order to better integrate and match. And so it's not just about addressing and fixing the failed systems, it's also about constant collaboration and getting people to talk together and work and own the problem as if it is their own problem. And because otherwise you're just not going to get to solutions. And then that's where the homeless providers, there's, and it's so interesting. We say this in the book, homelessness as an issue itself is homeless. There's in many jurisdictions, in some countries, in the U.S., there's no federal agency for homelessness. There's a stream of money that address homelessness, but it's attached to HUD and it's a housing urban development, but it's minuscule compared to the problem. And in some countries, you have the national commitment to homelessness, but it only deals with a certain aspect of it. So like in the UK, the national government has responsibility for homelessness, but that's to provide shelter. And so they have shelters, they bring people into shelters, they manage shelters. But if you're on the street and you're not knocking on a shelter door, that's not the national government's problem. And so that's where the issue of homelessness, being homeless, no one really owns it, falls on the mayor's lap, because the mayor is the closest to the residents of the city, and the residents say, damn it, mayor, when are you going to fix this problem of homelessness? You told us you were going to make a better city, and how come you haven't fixed it yet? And so then the mayor is left with this ginormous, complicated issue that feeds from the private, nonprofit sector, from the federal and state level, and it's left up to the mayors to figure out how to get all these people to the table and commit to this joint effort of overcoming homelessness.
So Linda described very well the structural and individual level and interpersonal level determinants that impact homelessness, that cause homelessness, and the recipe is slightly different in all these different cities that are described in the book. And it could be that that there is no national housing system in Mexico City to rehouse people living on the street, and that that substance use and mental health are pervasive in all of these cities, but the actual problems are different. In Bogota, they're smoking something called bazuco, which is a kind of free base cocaine. But in Mexico City, they're inhaling. It's young people inhaling solvents, and in the U.S. it might be white male middle-aged middle-agers drinking. And so like the recipe could be different in different places, but she describes it pretty well. But the challenge is, when you have those different recipes, are you going to have similar solutions?
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.